Puberty and Adolescence. My name is Marty Mott, and I'm one of your in-home parent trainers here at Frisco ISD. And joining me today are also Kimberly Goshi and Morgan Rosansky. This evening, we have a very special guest that will be sharing her expertise with us all. Please welcome Sean Kolb with STAR Autism Support. Sean will be joining us to share practical ways to support your child during this complex time. We are so grateful for her willingness to share her expertise on this topic. Thank you. Reminders, families, that this session will be recorded to send out to you and to share with all our families. At the end of today's presentation, we will have a Q&A for anyone joining us here online today. This portion will not be recorded. If you can hold any questions or comments till the end, it would be so appreciated. Also, if you can kindly mute your microphones during the presentation, this way it will allow us to hear all the information presented today. We are so excited that you're here today. This month's family learning event, Navigating Puberty and Adolescence. Again, thank you for joining us. And Sean, you can take it away.
All right. Thank you so much. Thank you for having me and for taking time out of your busy day, busy evening, I'm sure, to talk about this really important topic. I think, we all know that adolescence and puberty can be a really challenging time for our kids that are going through it. Just helping them understand what they're going through, what's going to happen, can be just really challenging. Tonight, we're going to be talking about some of those things, along with the importance of working together with the educational staff that works with your child, and making sure that we are on the same page, that we are sharing resources, that we are teaching the same routines, using the same vocabulary, all of those things. So we will just dive right into it. As Marty said, my name is Sean Kolb. I am a board certified behavior analyst. I also have I really just even hate to say this number, but over 30 years of experience working with children and adults with developmental disabilities. I have worked with kids as young as 18 months and adults, oh gosh, into their 70s probably throughout the years. And so I can't say that I've seen it all, but I've seen a lot of things. The adults that I worked with, most of them were in either a campus or a community-based group home. I also spent several years working at a state-run facility in Iowa, and so got to work with those individuals as well. I am currently a training specialist for STAR Autism Support, and in that role, I have the opportunity to train educators and caregivers on evidence-based practices, which I feel I'm lucky to be able to do, and I appreciate being able to be with you tonight. As I said, I think earlier, I do live in Iowa. I'm actually, funny enough, in Frisco this week, spending time in classrooms in Frisco, but we'll be headed home to chilly Iowa tomorrow night, and actually get to go to Grand Forks, North Dakota next week. So I will miss you all. And miss the Texas weather for sure. All right, a little bit more about STAR Autism Support and who we are and what we believe in. First of all, our mission is to advocate for every student to receive effective, high-quality instruction tailored to their specific learning needs through the use of evidence-based practices. When I say evidence-based practices, and it says here evidence-based curricula, all that means is that there has been research done to show that these things are effective and work with students with autism and other developmental disabilities. So STAR Autism Support uses evidence-based practices, and we work on training and supporting in support for educational staff and caregivers. We also focus on building school-wide and district-wide capacity so that we can serve students with autism and developmental disabilities. And we have a comprehensive approach across all grade levels. We have start with working with pre-K students and work with students all the way through transitioning past high school. We believe that the student growth and achievement in all learning environments is important. So the goals for our time today include learning more about navigating puberty and autism. We're going to talk through what that means, terms. We're going to talk through resources. We're going to talk through things to really focus on when you are working through puberty with your child. We're going to talk about routines that are associated with puberty and strategies to increase success in those routines. And then we have some free resources to help your child at home and in the community. A lot of our research, or a lot of our resources that we're sharing is from Ruth Ayers. She has worked directly with students with intellectual disabilities, autism, in public schools and as a consultant since 1997. She specializes in research and training educators and caregivers in the areas of sexuality and education. So a lot of the things that we're going to talk about for the next hour and a half really comes from Ruth and her research. Before we dive into it or get much further into it, I think it's important to acknowledge several things. One thing that we want to acknowledge is that you are the expert on your child. You know your child best. And that's important for us to realize and take that into consideration when we're talking about all of these things. Also, we want to acknowledge that caregivers and educators can learn from each other. And it's important that we are partnering with one another to make sure that we have can get to the best outcome for each student. Another thing to think about, or that we acknowledge, is that this is not a one-size-fits-all. We know that every family has your own values, your own beliefs, your own culture, and your own structure. And we do not want to take away from that at all. And so the things that I'm going to be sharing, my goal tonight is to share things that you can take and choose what will work for you and your family. Or things that maybe you can tweak a little bit so that they work well for you and your family structure. But I want to give you tools that you can use in your home. We also want to acknowledge that when we recognize students' strengths and build on those strengths, they're going to be more likely to succeed. And so that is another important piece to all of this as we're going through it. A little bit more about family and cultural preferences. This topic can be really, really uncomfortable to talk about. And many of us are not comfortable talking about it, especially with strangers. But it's a reality that everyone's going to go through. And so hopefully this will not be too uncomfortable for all of you, and you can gain some knowledge and resources about this topic. Also, being able to talk to other family members who are an important part of your child's life and your child's educational staff about this process is important, so that everyone is on the same page. So that if your family has some beliefs or specific values, that you communicate those things with your child's team, whoever makes up that team, so that we can all be on the same page and do what's best for you and for your child. These are a couple of quotes that we've had from caregivers, just to share some other people's parents' perspectives. One is, "My big concern is for him is knowing what's appropriate, knowing when it's appropriate, and knowing where it's appropriate. I think that's probably for a lot of families, that is something that if your child has had a concern in a specific area, that could be a quote from a lot of different parents. Another one is, she is uniquely Sarah. She's the one who will direct where we put our focus. Experts do not know my kid. I know my kid. And that for sure is true for all of you as well. So we're going to take a moment. I just want to give you a moment just to reflect on your own as we're getting started. First of all, who are those family members or important stakeholders? Who's on your child's team? Who is it important to include in this discussion once you have some tools after tonight? Also, the second thing is, does your family or culture have any specific views that would be important to share with the educators working with your child? You can avoid a lot of problems if by communicating, having open communication with your child's team, specifically about some of these topics that we're going to be discussing tonight. All right. So why is it important? So most educators and family believe that it is important for students with autism or intellectual disabilities, developmental disabilities, to receive sex education, but it's not always implemented. And so we want to look at why it doesn't happen. That's where we're going to start tonight. Some barriers, common barriers that we see is just that fear that talking about sexuality may encourage sexual exploration or confuse individuals. It is an uncomfortable topic for a lot of people. And there's a lot of adults, as an adult, that we maybe didn't have sex education, or we don't remember doing it, or we got put into a room with all girls and all boys and we watched a video and that was it. Or if you're like me, your mom threw a pamphlet at you as you were sitting on bed and told you to read it. That's what I got. So because of that, there's this fear of the unknown. There's a lack of resources and training to explain sexuality and puberty changes to individuals with autism and intellectual disabilities. I'm not sure about Texas, but there are some states that mandate sex education. But even in those states, students who are in special education may not be required to attend. So even if there is a mandate, our kids may not be getting any of that anyway. Also, sexuality education is more than just learning about bodies or just learning about sex. We're going to talk about a lot of different things that are related to sex education other than just those two things. That's part of it, but there's a lot of other areas too that are going to be important. There is a misconception that people with disabilities are not sexual beings and are seen kind of like childlike in our society, even as adults. But we know that most humans have the same social needs, which includes having a relationship with someone, having companionship, being able to go on a date, and pleasure. Those are all social needs that we all have. Unfortunately, sometimes this kind of education doesn't happen until something negative happens. The final misconception is that sexuality education is only about teaching anatomy and heterosexual intercourse. It's so much more than that. Adults with disabilities are often asking questions about, how do I get a girlfriend? How do I get a boyfriend? How can I ask someone on a date? How do I get a friend? Important things for families are, how do we allow our older teen, adult to be in a relationship and know they're not going to get taken advantage of? How do we help them interpret their own feelings and emotions or emotions of other people? So it's a lot more complex of an issue than just sex. So how do students learn about puberty and sexuality? As I said, many of us may not remember how we learned. We may have had that split boys and girls. We may have learned from older siblings or friends. So, you know, for our students, there may be conversations with caregivers or siblings or peers. There may be classes in school, but again, students in special ed may not be required to attend those classes. So they're probably not learning in school, which is why it's important as their caregivers that we have a plan to teach them about things and partner with their educators. There are risks of not teaching our kids about sex education, puberty, things like that. There is a higher risk of abuse or exploitation. Research has shown that children with disabilities in the United States are 4.6 times more likely than children without disabilities to become victims of sexual abuse. And that's a scary statistic, I think. Other risks are limited knowledge or preparation about changes can increase confusion and undesired behaviors. And then there's those safety concerns in public with non-family members and with strangers. I worked with a family who had a teenager who was not very good with social boundaries, and so would walk up to people and get into other people's space, and that caused a lot of issues for that teenage boy when he was doing it to teenage girls who didn't necessarily want that kind of attention. And so teaching some of these things is really, really important. So the SICUS group SICUS stands for Sexuality Information and Education Council of the United States. And they have developed guidelines for relationship and sexuality education for all students. And a couple of those guidelines include that all people have a right to education about sexuality, sexual care, and opportunities for socializing and sexual expression. School staff, caregivers, and family members should receive comprehensive sexuality education and training in understanding sexual development, behavior, and healthcare needs for individuals with disabilities. They have a publication called Guidelines for Comprehensive Education, Kindergarten through 12, that is available if that's something that you are interested in. So some of the important concepts when we think about adolescence, puberty, sexuality, some important things to teach or think about teaching is preparing for puberty. Now, some of you may have kids that we've missed this step, that they're already in puberty. That's okay. There's still time to teach. Other things are hygiene and self-care routines. Public versus private behavior is so important. Healthy relationships and social skills, personal safety, self-determination, self-advocacy. That's another area that starting young, teaching your student some self-advocacy skills can be really, really helpful. We're going to be diving into many of these topics during our time together. Okay. So how do we teach some of these things? Some of these skills? The strategies listed here are things that have been shown to be effective when teaching new skills. And these are new skills that can be anything, but will also work in the skills that we're talking about related to adolescence, puberty, sexuality, or sex education as well. So some of those things include using positive reinforcement, reinforcing the behaviors that we want to see and we want students to do, our children to do, can be very effective. That's probably the most underused strategy that can possibly be the most effective. So I encourage you to keep that one in your tool belt for sure. Modeling and prompting. We're going to talk a little bit about prompting and how to prompt and fade your prompts in a little bit here. Video modeling and social scripts have been shown to be effective. Role playing, also a strategy that can be effective. Practicing routines, task analysis, we'll talk more about what that is in a little bit here. Visual supports have been shown to be very effective, particularly for individuals with autism. And we have some visual supports that we'll be sharing with you. And then repeated practice with the goal of generalization. Just because your student learns something in the classroom setting does not mean they're going to be able to perform that same skill at home. So practicing in multiple locations with lots of different people is important. So this next section, we are going to talk through what to expect with puberty and how autism may impact those things. So one thing that we all know, because we've all been through puberty, is that it's unpredictable and it's unavoidable. Everyone's going to go through it. Students with autism, some students with autism do struggle with change. And so that can be very challenging for them, but it's going to happen. Typically, the range is between 8 and 14 years old. 8 seems really young, but that is that may happen. Kids as young as 8 may start going through puberty. On average, girls start at 11, boys start at 12. All individuals do need special care and patience during this time. I think if we can reflect back and remember a little bit about when we were going through puberty, we can remember that needing perhaps a little extra patience for things. And also those who don't identify with the sex assigned at birth may find this stage more challenging than others. So, as I said, puberty changes are unpredictable and unavoidable. Some students that have resistance to change, I don't know if any of your kids are what some might say are rigid, have rules, they follow them, they like the structure, and some of that kind of flies out the window when you're going through puberty. And so that can be really challenging for those students in particular. Understanding bodily changes, what is going on with my body? Why do I have hair in my armpits now? What in the world? Where's it coming from? Understanding social rules. Those are things that a lot of students I've worked with autism, they have to be really specifically taught what the social rules are. They don't pick up on those things by observing other people. And so taking the time to teach them those rules and helping them practice is really important. Communication is hard. There's this picture where this guy here has butterflies in his stomach. And how do kids express that to us? How can they describe that feeling of butterflies in your stomach? When we say it, we know what we mean. But if you don't have those words, it's really challenging. Repetitive and restrictive interests may intensify during this time. And then those sensory processing issues may make it more challenging. for some of our kids. So what can we expect, and what can we prepare children and adolescents to expect? Some of the things include body odor and hair, voice changes for boys, changes to their body's shape and size, acne and oily skin, and menstruation are all things that we can expect probably are going to happen. When it comes to hormonal changes, we're going to sweat more. We're going to be hungry. Perhaps there's going to be some mood swings. We're going to start developing sexual feelings and maybe start feeling attractions towards other people. So where do we begin? There's so much to teach. But a great concept to begin teaching and practicing, even at an early age, is public versus private. So why is this important? Teaching that the child's whole body is private is a great first step. And helping them understand that so that they don't have inappropriate actions because they're confused, or they have a lack of awareness, or there's limited social understanding. We want to encourage responsible and safe and social sexual behavior. When we talk about teaching private versus public, it starts with the whole body is private. We also want to make sure that we are using terminology to teach and using correct terminology. Knowing that some of the kids that we work with some of our kids may have difficulty communicating. It's really important to start using correct terminology, because if they are reporting something, someone will know what they mean and what they're saying. If we have a code word for penis in our house and your student or your child tries to use it with someone else and they don't know that code word, it's going to be confusing. So what is privacy exactly? We want to teach this to children, and we need to make sure that we understand this term ourselves and identify specifically what we teach. So when we say private, we mean a private place is a place where you are by yourself and no one else can see you or hear you. So things that we would want to teach are, what are examples of private places? What are behaviors that should be done in private? And then we want to give them opportunity for privacy. Not that we're encouraging any specific behaviors during that time, but we want to make sure that they can experience private versus public when we move on to talk about public. So when we talk about public and we teach public, a public place is anywhere other people can come in and out of, even if you're alone at the time. So in some families, based on kind of family rules and dynamics, a bedroom may be a private place. In other families, a bedroom may be a public place. So that's one of those things that's going to depend on kind of what the family dynamic is and what is the structure of kind of the rules you have in place. Things that we want to teach about public is, what are public places, what behaviors are okay to do in public, and what behaviors are not okay to do in public, and perhaps what the consequences are going to be of that, of doing private behaviors in public. So we know that individuals with autism learn best when they have concrete examples and lots of opportunities to practice a skill. As I said before, teaching and using accurate terminology is important. And we want to teach a child that their whole body is private. So even their personal space can be private. So it's not just that my genitalia is private, that my whole body is a private space. When we talk about private behaviors, if you're starting to wonder what behaviors are private, this is a starting place that you could, what I would consider non-negotiables. Exposing private parts of the anatomy by undressing, pulling down, or lifting up clothes. Scratching or touching genitalia. Fixing or adjusting underclothing. Masturbation. Consensual, romantic, or sexual activity. A couple things on this. One is, as I said, a lot of kids that I've worked with are very concrete. So if you're going to teach them about adjusting clothes, make sure that you are specific to what you consider underclothes, bras, underwear, because you don't want them walking around correcting people if they're, just hiking up their pants or something. Say, hey, don't do that. Another thing I will say about masturbation, I know that it can be a very touchy topic, an uncomfortable topic. And again, you need to decide or go with whatever your family values, culture, all of that. However, I will say that the American Academy of Pediatrics has stated that it is a normal process or normal part of development. And I think it's important to know that, that it is just part of a child's development, that they may become interested in that. You have the final say of your approach you're going to take on that. But I think it's important that you are able to have conversations with your child's whole team about your feelings on that, so that your whole team can be on the same page specifically regarding that topic. One thing that I have worked with a lot of adults, because they didn't get this training when they were adolescents, is that if you want to masturbate, that's fine. You need to do it in a private place. So that's where it goes back to that private versus public training that you can do with your adolescents. So this is a great activity and a great place to start if you want to start teaching and talking about public versus private. There is a QR code here on the screen. If you want to take a picture of that, you will get access to a sorting activity that has images and that can be categorized into either public or private. It also can open up some nice discussion about those images and the topic. And you can choose to use what images you use and what images you prefer not to use based, again, on your family beliefs and values and things like that. If this is something that you're using at home, this would be a great thing to share with your child's education team, especially if there are images that maybe you don't want to use or that you want to keep out. But even if not, it's a great resource that you could share with your child's team. So if there comes a time where you need to redirect your child at home because they are displaying a behavior related to sexuality that you're not comfortable with, that you don't like, that they need to be doing in private, any of those things, we want to, rather than just saying, stop doing that, or stop that, we want to teach your child what to do instead. So first of all, avoid punishing or reprimanding. If you're okay with it, redirect them to a private space like a bedroom or a bathroom. Label that behavior as private behavior. You can work on teaching them to wait if it's a behavior that they're doing at dinner time and you want them to finish their dinner. You can work on teaching the skill of waiting. Pay attention to patterns or common times and use that to your advantage. Put things in place that if it's happening at times that you prefer it not to happen, I have in a couple slides coming up, there's some things that you could do or redirect them to. And then again, make sure everyone on your child's team is consistent on how they redirect your child and what language to use. It gets really confusing to kids or adults if they're getting different messages from different people. They end up not knowing what's right, what's wrong, what's okay, what's not okay, and they get confused. And so this is where having the whole team on the same page as far as how you're redirecting, what language you're using is really, really important. So when you think about your child going out in the community and perhaps engaging in some behaviors that you don't want to see, some things that have worked include considering clothing that might be more challenging to easily remove. I've worked with kids, usually it's younger kids, but I've worked with kids who can disrobe in like 2 seconds flat. They're so fast. They're like Houdini. Anyway, so some things that I've seen work is using a belt that may be a little challenging for them to unbuckle. I heard of, there was a student that was really struggling with disrobing at school. And so their team came up with a plan that she would put overalls on over her clothes. And she wore the overalls at school. And for her, it was just a cue. It was enough of a cue to know, okay, I can't take my clothes off here. And that worked for her. So sometimes you have to get kind of creative and try some different things before you find what works. But consider what other types of clothes that you could use to make it a little more challenging to take off. Engage them in other tasks. If your child is doing things with their hands that you don't want them to do, find things for them to do with their hands, whether it's holding a preferred toy, holding an iPad if they have to, engaged in some task that they are going to forget about, putting their hands in their pants. So I think about behaviors that it's just physically not possible to do the two at the same time. So if a student's holding an iPad or a book or something, they're not going to be able to put their hands in their pants. So that's something else to think through and can be effective. Using consistent terms like hands out of pants, hands down, wait for home. Really important. And again, this one is making sure everyone that is important to your child is using the same term in common language can be really effective. And then teaching which behaviors are okay in public, including how to interact with other people. Who is it okay to hug? Who is it okay to kiss? How close, if I want to greet someone, how close can I get to them? Sometimes I just use the visual of just having my hand out in front of me, and that space is my space. Unless I invite you in for a hug, that's my space, and you should ask before you come into that space. So teaching some concrete things like that can be really effective. So as puberty, hygiene and self-care routines become even more important than pre-puberty, I would say. So when we think about puberty, we think about teaching routines for putting on deodorant, washing their face, using a menstrual pad, showering, shaving, wearing a bra. And so let's talk about what that looks like. So if you were to create a routine for your student for any of those, the place to start would be observing your child or a sibling, or have you yourself do the task. Write down every step of that routine and teach them, your child, to do that routine in that order every time. Sometimes steps need to be broken down to even smaller steps to increase success. So an example might be a step for toothbrushing is put toothpaste on your toothbrush, but you may have to break it down to take the cap off the toothpaste, squeeze the toothpaste from the bottom. You just may have to break some steps down even to really, really small steps when you're doing that. But when you're breaking a routine down into small steps, that is a task analysis. That's all a task analysis is. And you're going to use those steps to teach your child in a consistent, predictable way how to do a routine. So they're going to learn, oh, when I do this step, and then I know this is next and this is next. Sometimes we have to start our teaching with just labeling objects so that when we say get your deodorant, we want to make sure they know what deodorant is. And we can assume that they are going to know what that is. So you may have to make sure that they know the names of new objects or pictures or words associated with the new routine. The other thing that we always do or think about when we talk about routines is organize the environment to help increase their success. We want to make things that they need as accessible and easy to find as we can, placing items in a labeled bin or spaces that they can get to independently, and then adding visuals or a written reminder so they can see clearly, here are the steps of this routine. The next thing to think about if we're teaching a routine is identifying that time to practice. You have to be really purposeful about this and making sure that you have a time identified where you're going to practice this skill every day, as often as you feel necessary. So you're going to practice the steps of the routine and focus on encouraging your child to do them as independently as they possibly can. You're going to plan times to practice before the routine actually occurs and collaborate with school teams. A lot of these things can be also practiced in the classroom during your child's day. And so it'll be important to collaborate with your student or your child's team as you're working on these things at home. I think this gets forgotten a lot. I said that earlier. We all need a little reinforcement to be motivated to learn new things. When we are teaching new skills to kids, they got to know what's in it for them. Why am I, they're not going to be just super motivated to put deodorant on every day. Just not smelling may not be enough of a reward for them. So some individuals may need rewards or activities to look forward to after they complete routines, and others are okay with just verbal praise. And obviously, your child best. You'll know if you need to provide that reward or motivator, or if you just are there giving high fives, fist bumps, if that's going to be enough for your student. But don't forget to do that. All right, here is some information on prompting. So a prompt is really any kind of assistance from another person to help a child, a learner, with a task. So there's going to be times when a child is learning a new routine that they don't really know what exactly they should be doing. So we want to encourage them to complete the step of the routine correctly. We don't want them to practice mistakes. We want to help them do it correctly. and make sure they're practicing doing the step correctly. Prompting can be used to support lots of different skills and can help individuals to learn to complete routines independently. So on this next page is another document that you can scan to get a copy of. This talks through how to prompt during routines. So what we recommend is directing your child's attention to the cue and say it once. Give them a chance to respond in typically 5 to 10 seconds. Again, you know your child best. Some kids need a little bit more time to process, others not so much. You're going to respond to their attempt. If it's a correct response, you're going to give them some kind of positive feedback, whether it's just, that's right, good job, or a high five. If they're not getting it quite right, you're going to repeat that cue, get toothbrush, and provide the least restrictive prompt to make sure they get it right. So for some, that may be just pointing to what they need to do. For others, you may have to help them guide their hand to where it needs to go. But again, you know your child best and will know what they need. After they get that step done, you just go to the next step. Repeat, give them the cue, give them a chance to respond, and then either give them that praise or help them do that step as independently as possible. One thing that I have seen a lot, and so I get on a soapbox about this just a little bit, is sometimes we like to do everything for our kids. And we create prompt-dependent adults who can't do anything for themselves. And so a couple tips to avoid that is always use the least restrictive prompt necessary, and try to fade those prompts back as quickly as you can. The longer some kids are going to need prompts for a while before they pick up on a new skill. But the longer you're in there and providing them help, the harder it's going to be to fade back those prompts. So I really want to encourage you to fade back those prompts as quickly as you can. Teach them these skills so that they can do it as independent as possible. I'll get off my soapbox. I just feel pretty strongly about that one. Thank you. All right. Visual strips, using visuals. A lot of kids with autism are visual learners. And so providing them this extra support can really increase the success that they have in learning a routine. So we recommend posting a visual strip in routine areas that have the important steps that you want them to do. You will say the step and point to the visual or model the action, and then give those prompts as needed. The goal eventually would be they can have this little visual strip where they need it for a routine, but you don't have to be there. They can use that. That's going to be enough of a reminder for them to make sure they hit each step. Some sensory needs to think about when we think about different hygiene areas. Deodorants have scents, so make sure you're giving them choices. They may be very averse, and again, you know your child, you're going to know if they're not fond of a particular smell. Electric razors may feel that might just be they might have to get used to using them. So sometimes we'll just hand a student a razor and let them get used to the feel of it while it's turned on. And then it may be it's just a touch, great job, that's it for the day. Then you're gonna maybe work on actually shaving apart, but kind of build up tolerance for the feel of that on their face. Also, menstrual pads may feel uncomfortable, but there's different kinds out there, so you may have to try different ones before you find what works for your daughter. On the topic of menstruation, sorry for those of you who have boys, but it is an important topic that for girls can be really, really critical that we teach them how to do this independently. So when we think about supports for menstruation, if you can start early to prepare your child, that includes talking about it, helping them know what to expect, talk to school staff so they so that the routine you're doing at home is being done consistently at school. There is using a menstrual pad book that you can download and read and explain the routine to your daughter. Also, this is really helpful. Consider using a calendar and app to track cycles so that you can anticipate when it's going to happen. Some pre-teaching with a pad routine that you can do is simulate the routine with a doll, practice the step of removing, properly disposing, replacing, and hand washing. One thing you may want to consider if you're going to do that is add a little red dye to the pad so they see what it's really going to look like. Practice the routine before menstruation to increase comfort level, and make sure that you're packing pads on outings and to school as well. During menstruation, use and post, we have a visual strip that you can use. Excuse me. Add visual cues for independence in placing the pad. So one thing you can do is use a marker and draw 2 dots on the underwear so the child can match the dots with the bottom of the pad. Consider a schedule or checklist to change pads regularly. I think that would be really helpful as well. Again, this is something that you can take a picture of, scan, and get access to some of these visuals if you would like. So another important topic related to all of this is advocacy and awareness. Teaching advocacy, self-advocacy skills early is really important. Those things can be understanding their own emotions, being able to identify the emotions they are feeling and the emotions of others. Being able to refuse something, teaching them how to refuse or how to say no to something is an important skill. Teaching them to ask for help. Teaching them to report an illness, an injury or abuse, helping them find a way to, say, I'm hurt, my stomach hurts, identify body parts. All of those are important skills for kids to have. And then again, understanding consent and that their whole body is private. So when we're teaching that private versus public, we're starting with that their body is private. Boundaries. This is a hard one for some kids. Especially those kids who just like being around people. But teaching about personal space and asking for privacy is really important for kids. There's ways that we talk about teaching skills in a concrete way. And so sometimes using images with standing in a hula hoop, that might be a visual that kids might understand and talk about personal space. Another thing is if you have outside caregivers, respite support, one thing to consider with them is making sure their values and teaching styles align with your family's values and teaching styles. Another thing is making sure everyone's on the same page about providing minimal assistance and fading back those prompts as you're teaching some of those new skills. Make sure we're not creating prompt-dependent adults. And continue to build independence during self-care routines, such as toileting and dressing. The risk of abuse has been shown to decrease as children learn to be independent in self-care routines. So, if they don't need someone in the bathroom helping them, there's going to be less of a chance of perhaps some abuse happening in the future. So something to think about when you're looking at, okay, what are the important things to teach my child? Relationships. Excuse me. I think sometimes there's a misconception about individuals with autism or autistic individuals that they don't care about relationships or they don't want relationships, but I don't believe that to be true. I believe that they do want relationships. They may just not have the skills to develop relationships. And just like, I said, I work with kids as young as 18 months, just like I had to teach them how to play with different toys. We may have to teach our older kids how to develop friendships and teach it in develop a task analysis for here are the steps for starting a conversation. Here are questions that you could ask someone, things like that. So this is a task strip that we have for teaching someone how to socialize with friends. And that is something that we use at STAR. Some other things is teaching kids how to get to know someone and how to develop friendships. And so you can use supports to teach conversations or teach how kids to stay on topic. Anybody have a kid who has special interests and they can turn any conversation into their special interest topic. So working on that and helping them have a back and forth conversation about other topics is important. So helping your child explore different topics at dinner is a great time if that's something your family does, is have dinner together, or being purposeful though about teaching them those things. Here's an example of conversation supports or questions that you can use to start conversations about different topics, or teach your child questions they could ask someone to get to know them. Okay, we have a few resources that we feel are great resources. This is Sexuality and Relationship Education for Children and Adolescents with Autism Spectrum Disorders. It is research-based. It's grounded in behavioral principles and has lots of different resources. This book is really meant to be in schools, but parents some parents have found it to be a useful resource for them as well. So that might be one that you might want to check out. The Healthy Bodies Toolkit for Boys and Girls was developed by Vanderbilt University, their LIN program. It's a toolkit that you can download for free, and it was developed for parents. They have lots of resources in this toolkit. I looked through it the other day. There's lots of visuals that you can use at home. There's different storyboards in there. So that's a great one. It's free. You can download it. I recommend checking that one out for sure. Another great resource that's online is Amaze. There are videos that you can watch or share videos with your kids to learn about different topics. Some of them are humorous, and so they help talk about maybe sensitive topics or uncomfortable topics in a fun way. But this is kind of an engaging site that has lots of different resources and toolkits and lesson plans and promotional materials. So this is a great one, again, to check out. if you are looking for resources. This one I have not looked at, I'm going to be honest, but there's professionals and parents can use it as a workbook or in a small group. It puts gray thinking social information into black and white systematic format and directly relates behavior to possible outcomes that can affect personal freedom and increase motivation to learn. Some final tips, just before we finish up in a couple of slides here. The first one is, again, even though this is an uncomfortable topic, keeping your discussions and teaching positive and having a sense of humor can make it a little bit easier. Once you discover your child's personal style, which I'm sure you all know, style for learning, you can make room for individuality. Avoiding talking down or speaking negatively about puberty change can impact your child's attitude about the changes they're experiencing. And again, role play is one of those things that can be uncomfortable for people, but it can be effective. So role playing, practicing, and discussion, all of those tools can be very effective when learning new skills and new routines. If you, I'm not sure the age group of the kids in your guys' families, but the earlier you can start, really the better. Using strategies that have been successful for teaching your child other skills can be applied to this topic as well. Don't forget to be patient, celebrate the small steps as you go along this journey. Here is another area where you can scan on our website. This will take you to our website. You can also Google Star Autism Support and this page comes up. You don't need a login, but we have lots of free home supports. Some of the things that you saw tonight can be found here. Other things include some materials and resources, so some different games or activities. There are lots of different visual supports, so the ones you saw tonight, and then lots of other visual supports that you might find helpful. The other thing on our website is some home support webinars. So how do you teach a routine? How can I increase motivation in my child? Do I need a schedule? And how would I use a schedule in my home? How do I use visual supports effectively with my child? How do I prompt for things? How do I fade my prompts for things? And lots more. The webinars are not full-hour webinars. They're shorter than that. They're meant to be watched. They're meant to be easy to watch and just get you the really important information. And so those are there on our website as well. I'm going to skip over that one for a moment till we're done. But if you want to find other resources or anything else, I'll do a quick plug. We're on all the socials. We do have a podcast where we interview lots and lots of different people. We interview parents, we interview educators, therapists. There was a geneticist on last month that I found very interesting. So there's lots of different topics on the podcast, but we also share different ideas on Facebook and things we've seen work in classrooms on the other social medias as well. So with that, I believe I'm going to turn it over and then we will stop recording, I believe, and open it up